My name is Brittany Brockway, and I'm majoring in public health, and I will be covering the topic of bronchitis today. Bronchitis is the inflammation of the lining in the bronchioles. The bronchioles connect the trachea to the lungs, and inflammation can cause difficulty in breathing because there is less room for the air to travel through. Each case is different, but typically bronchitis lasts between 3 and 10 days. However, the symptoms that are associated with bronchitis may last longer. There are two different types of bronchitis. Acute bronchitis is a short episode of bronchitis with coughing that usually resolves in a few weeks. It originates from the virus that causes the common cold and the flu. However, acute bronchitis can also be caused by bacteria. Some of the contributing factors to bronchitis include smoke, dust, fumes, and air pollution. Chronic bronchitis is defined as the daily episode of coughing with sputum present for 3 months or greater. The number one contributing factor to chronic bronchitis is smoking and secondhand smoke. Air pollution, dust, and fumes can also be contributing factors. The signs and symptoms that you should look for if you believe that you have bronchitis include coughing with colored mucus, chest tightness, fatigue, body aches, fever, and sore throat. The symptoms typically last around 2 weeks, however, some of them can last up to 2 months. Risk factors for bronchitis include smoking, exposure to secondhand smoke, chemicals, dust, air pollutants, a history of respiratory illnesses within the family, a personal history of respiratory illnesses, and those with a compromised immune system, such as elderly patients and infants. A few ways that you can prevent bronchitis is to stop smoking and to avoid secondhand smoke, get the flu vaccine, practice good hand hygiene, wear a mask when you're working with patients who have bronchitis, and avoid chemical irritants. The most common complication of bronchitis is pneumonia. Pneumonia can be treated with antibiotics. Sometimes it does require hospitalization depending on the severity. And 1 out of every 20 cases of bronchitis leads to pneumonia. There are a few different tests that can be done to diagnose bronchitis. One of the tests that is used is called a pulmonary function test, or PFT. This test requires a patient to breathe into a tube, and it measures the airflow and the volume that is present in the lungs. A chest x-ray may also be performed, and it can determine if there is fluid present, or if there's inflammation present, and to rule out any other respiratory illnesses. A sputum examination is the analysis of sputum. Sputum is a mixture of saliva and mucus from the respiratory tract. Depending on the consistency and the color, we are able to determine what type of illness the patient may be experiencing. Patients who have bronchitis are typically given antibiotics, only if it is caused by a bacteria. Antibiotics do not kill viruses. Other medications that patients may be prescribed include cough suppressants or expectorants. Cough suppressants help to decrease the amount of coughing, and expectorants help to thin the mucus. Patients can also be given steroids in the form of pills or inhalers, and these can be used to decrease the amount of inflammation present within the lungs and the bronchioles. A patient who suffers from chronic bronchitis may benefit from working with a respiratory therapist or a pulmonary rehabilitation center. In 2014, there were 8.7 million adults that were diagnosed with bronchitis, and of that number, 147,101 deaths occurred from lower respiratory disease. Out of a population of 1,000 adults over the age of 16, 44 people are expected to be diagnosed with bronchitis. And of these cases, 82% occur during the fall and winter months.